According to a 2020 article, about half of the U.S. adults say it is difficult to afford healthcare costs, and 1 in 4 say they or a family member in their household has had problems paying for healthcare in the past 12 months. This is an alarming statistic. Should someone not receive medical treatment because they can't afford to pay for it? Or does COVID or other diseases know the economic ability of a person to pay for their healthcare? Of course not, no. So if your neighbor gets sick and does not receive treatment because he or she cannot afford it, then you will be at a higher risk of contracting that same illness. Everyone should care about the topic of universal health care because healthcare affects you, your family, everyone. Everyone needs access to healthcare, whether it be for preventative services, for treatment of acute illnesses, for chronic treatment, and for the diagnosis and treatment of more severe conditions. A universal healthcare system is a system that is affordable and beneficial for all. This is an issue close to my heart because I have seen people die or suffer from a life-altering illness because of their lack of access to healthcare. In addition to this personal connection, I am a pre-medicine student and have been accepted into the Texas A&M University Medical School. I have read many and researched many articles about this topic. So, in my speech, I will discuss a couple of the main points that elaborate on the benefits of a universal healthcare system. First, I will briefly explain and define what universal healthcare is, along with what healthcare system the U.S. is currently using. Second, I'll talk about how a universal healthcare system increases access to healthcare services for all of the population. Third, I'll discuss some of the economical benefits of a universal healthcare system. And finally, I'll mention some of the ways a universal healthcare system increases the use of preventative healthcare measures. Okay, let's define what universal healthcare is and go into what healthcare system the U.S. currently has. Universal healthcare is a healthcare system in which all residents of a particular country or region are assured access to affordable healthcare. According to the World Health Organization, it means that all people have access to the full range of quality health services they need, when and where they need them, without financial hardship. It covers the full continuum of essential health services, from health promotion to prevention, treatment, rehabilitation, and palliative care. The U.S. healthcare system is a mixed system, made up of a combination of private and public systems, which are paid for by a combination of things, including public programs, private insurance, and out-of-pocket payments. This healthcare system structure results in a high-cost healthcare, but lower quality treatment being delivered. It also has an increased financial burden on the patients and businesses paying for it, and it has major healthcare disparities. A universal healthcare system helps increase everyone's access to healthcare, regardless of their social or financial status. According to a research article, currently, the United States is the only wealthy, industrialized country that has not achieved universal health coverage. The article goes on to say, the nation's existing healthcare system is inefficient, unaffordable, unsustainable, and inaccessible to many. So, now that we know what a universal healthcare system is, let's go over some of its advantages. The universal healthcare system provides increased access to healthcare services for everyone. Universal healthcare allows all people to get the full range of quality health services they need, whenever and wherever they need them, without financial hardship. Universal healthcare diminishes the impact of social and financial determinants by giving everyone access to healthcare services. This healthcare system has the power to save lives, decrease cost, and improve the quality of life for everyone in our country. As stated by another research paper, single-payer universal healthcare has the potential to improve the quality, cost-effectiveness, and accessibility of medical services. Universal healthcare would also help the people who often need healthcare assistance in their most needed times. Universal single-payer coverage eliminates the danger of losing healthcare when it is needed most. For many Americans, a serious illness precipitates the simultaneous losses of income and employment-based insurance. This is an example of when a universal healthcare system would be very useful for people. A drawback of a universal healthcare system could be the potentially longer wait times in clinics and healthcare facilities. However, with strategic planning and better organization, this challenge can be overcome. I believe the benefit of a healthier society and country should not let this small barrier prevent the universal healthcare system from moving forward. In addition to increased access to healthcare for all people, there are also many economic benefits. One of the first economical benefits of the universal healthcare system is that it allows people to make the most of their strongest asset, the country's people. Healthy people are able to live healthy lives and are more economically productive. According to one article from the Institute of Medicine, the indirect costs associated with preventable chronic diseases, costs related to worker productivity, as well as the resulting fiscal drag on the nation's economic output, may exceed $1 trillion per year. A lack of healthcare access for workers has an enormous impact on the nation's economic output. The universal healthcare system would also benefit small businesses. Small businesses are a strong driver of national job growth and innovation. However, due to high cost, many small business employees lack access to healthcare. Universal healthcare would provide savings for employers, allowing them to keep wages in line with the rising cost of living, as well as decreasing lost productivity due to employee illness. One of the major counter-arguments of this is that business owners would need to spend more time dealing with the government red tape. However, it does not have to be this way with proper planning and organization. One of the long-term benefits of people's health as a result of universal healthcare is increased use of preventative healthcare services. So, people who do not have insurance or do not visit a healthcare provider regularly are more likely to suffer from preventable diseases, such as type 2 diabetes. A universal healthcare system will provide individuals with early access to healthcare, which is shown to prevent chronic diseases from occurring or developing rapidly. A study says universal healthcare will better facilitate and encourage sustainable, preventative health practices and be more advantageous for the long-term public health and economy of the United States. Increased access to preventative medicine includes annual checkups, receiving vaccines to prevent illness, or at least decrease the severity of an illness, and testing to provide early diagnosis and treatment. A universal healthcare system will help improve access to preventative care, resulting in lower healthcare costs and less chronic illness and healthier people. So, today you have learned what a universal healthcare system is and what type of healthcare system the U.S. currently has. You've also heard about several of the advantages of a universal healthcare system, including how it provides services for everyone, broad economic benefits, and increases the use of preventative services. I have acknowledged several of the counterarguments against a universal healthcare system. However, I still believe that there are a variety of solutions to those issues. A universal healthcare system is a system that is affordable and beneficial for all. Overall, the primary battle against universal healthcare is the significant upfront costs and logistical challenges. However, the benefits of a universal healthcare system will lead to a healthier population and thus, in the long term, lower economic cost. Every person deserves the right to appropriate healthcare when they need it, and the current healthcare system isn't offering that. While a universal healthcare system may not be perfect, I believe it is a step in the right direction in creating a healthy and well cared for nation. Thank you.